Hi, my name is San. I'm a level 1 nursing student. Can I follow you around?
Of course.
I have a few questions to ask. Could I get the SPA on the patient, please?
You can. This patient is Ryder Kind. He's in room 620. He's a full code, no allergies. He's a male, and he's 67 years old. The patient was admitted with a stage 2 diabetic pressure ulcer located on his right heel that's been leaking serosanguineous fluid. The patient did have some pain recently. His pain was a 6 out of 10, so we went ahead and administered 4 milligrams of morphine sulfate. And at 16:45, the patient did say that his pain level is now a 1 out of 10. The patient's alert and oriented. And I will say the patient has a 20-year history of diabetes mellitus type 1. Over the past 5 days, his blood glucose level has been elevated above 300. We recently took his blood glucose with an AccuCheck at 16:45, and it was at 290, which is still pretty elevated. His vital signs are 16 respirations. His temperature is 98.4. Heart rate 76. His oxygenation is at a 96, and his blood pressure is a 128/70. I think I mentioned the patient is alert and oriented, is aware of what's going on. He wears glasses, has a history of hypertension as well as high cholesterol, and the patient walks with a steady gait. The patient, his breaths are even and effortless. He denies any cough or like any type of chest pain. His radial pulses as well as pedal pulses are both +2 in the left and right feet and hands. Patient's S1 and S2 sounds can be heard. There's no murmur. There's a regular rate, regular rhythm. We are keeping the patient on a special diet, 1,800 calorie restricted. It's a 2-gram sodium diet as well. So really at this point, we're just trying to make sure that the patient's glucose level is being managed correctly. And not only that there's no pain with the pressure also. The patient does take some medications, 20 milligrams of simvastatin, 600 milligrams of gabapentin, and as mentioned earlier, the patient did receive 4 milligrams of morphine sulfate. And the patient's going to be getting regular insulin today just to help, manage his diabetes.
Why specifically this client receiving the medication?
The patient is hyperglycemic. His blood glucose is really high right now, so we want to lower it.
What action medication have on the body?
Basically, insulin helps to transport glucose into the skeletal muscle and the adipose tissue.
When should you question administering this medication?
If the patient was hypoglycemic, his blood glucose was below 70 or had any signs of hypoglycemia.
Does it have therapeutic serum level?
It does not.
Which vital signs must be monitored?
All 5 of them: respirations, heart rate, blood pressure, oxygenation, and temperature.
Which physiological parameters should be monitored when
I'm going to check for any signs of hypoglycemia. So if the patient has like any tingling in the mouth or extremities, confusion, dizziness, any type of chest pain or heart palpitations, fast heart rate.
What intervention must be taught to the client to ensure the medication is administered safely in the hospital setting?
To make sure that the injection site is being rotated, to make sure that aseptic technique is being followed and the doctor's orders are always being followed as well, the sliding scale.
What intervention must be taught for the client to administer the medication safely at home?
Proper aseptic technique in the hospital, you're going to use an alcohol swab. At home, you can use like warm soap and water. Make sure always follow doctor's orders, know how to use a sliding scale, an AccuCheck, and make sure that you don't change the medication without first discussing it with a physician.
What kind of side effects and potential adverse reactions is this medication?
Side effects, you'd have hypoglycemia and adverse reactions, anaphylaxis.
How will you know the medication is effective?
We're going to check the patient's blood glucose with an AccuCheck.
Thank you.
Okay, so before I go ahead and pull out a new medication, I'm going to go in here to the patient's chart, make sure that I have the right patient that I've been assigned to. All right, so he's 67 years old, Ryder Kind. It does say here he has no allergies. So I'm going to go ahead and look to see what I'm going to be giving. I'm going to be giving regular insulin. I'm going to be giving this medication subcutaneously. So I know my patient, I know the time I have to give it, the type of medication, and I know the route's going to be subcutaneously, and the dosing I will look at a sliding scale based on the patient's blood glucose. That will determine how many units of insulin we're going to be giving. So I'm going to pull up my med. I'm always going to look just to look inside the vial, see if there's anything going on in here. I'm going to check the expiration date to make sure that it's valid. Always want to check that. I'm also going to make sure that this medication matches up correctly with the MAR. Just because I'm pulling it from the Pyxis doesn't, mistakes happen. So I always want to double check that. Okay, so everything looks okay here. I can always also, I can check with the farm book if I have any questions about this medication, if I have any questions about how it should be administered. I can call the pharmacy, and I can ask if something needs to be given with it, like food, or if it needs to be crushed. In this case, it doesn't, but it can always be good just to verify that with the pharmacology book or with the pharmacist or a physician. So I've got my medication and what I'm going to be doing here with my patients. So I'm going to go ahead and wash my hands, go into the patient's room. I'll introduce myself. Hi, I'm Matt. I'm going to be your nurse today. I'm going to raise the bed. Can you go ahead and tell me your name, sir?
Yeah, I'm Ryder. I'm 67 years old.
Okay, can you tell me if you have any allergies?
No, I don't.
Okay, no allergies, great. Well, what we're going to be doing today is we're going to be giving you some insulin. We want to get that blood glucose level lowered. Your AccuCheck showed a 290, so we want to get that lowered a little bit. Could you tell me the last place you had your insulin injected?
I think it's on my thigh.
Okay, well, would it be all right if we went ahead and did it in your arm today?
Yeah, that's fine.
Okay, do you have any preference between left or right?
No.
Okay, so why don't we go ahead and do it in the right? We always want to make sure that we're rotating the injection sites just to prevent any skin breakdown by repeated injection into the same spot. Also, I just want to let you know, with this medication, sometimes people can become hypoglycemic. So if you have any signs of dizziness or chest pain, any tightness in the chest, or fast heart rate, or any tingling in your mouth or extremities, just to go ahead and let me know, or let one of the other staff members know. Okay?
Okay.
Okay, great. So I'm going to go ahead and get your medication here. So I'm going to look here. I'm always going to check the MAR for allergies. I ask the patient, but I always want to double check with the patient's medical record to make sure that there's no allergies. Yep, nothing here. Okay. So I'm always going to check, the MAR again, check to make sure I have the right patient, right or kind, that I'm giving is at the correct time. I'm going to be giving the route subcutaneously, that I have the right dose, which would be 16 units of insulin regular. Because the patient's blood glucose is at 290, I look at the sliding scale, and I'm going to make sure that I have the right medication as well. There's 5 rights I always want to check, multiple times against the MAR to make sure that all that's being followed properly. So go ahead and I can scan my patient's armband. Click that here. Just go ahead and scan it again. Okay. A little bit of a scan. Third time's the charm. Okay, right or kind pops up. Okay, and that's yep. Medication pops up. So I have the green light on my medication here. So I'm going to wash my hands. So I do have a green light. It's been verified. I have all 5 of my patients' rights, the right patient, right medication, right dose, right time, and the right route as well, subcutaneously. That's all been verified with the MAR. So I can pull out an alcohol swab. I've got my medication here, everything matches up. I'm going to spend 15 seconds wiping this down with an alcohol swab. Okay? I'm going to pull up 16 units there that I can inject. Okay. Now with insulin, I've used a one-hand recap, and I'm always going to have another RN just verify to make sure with any type of insulin. So if you could just take a look at this for me, just make sure that's the correct amount, 16 units.
Yeah.
And that I do have a green light here.
Mm-hmm.
Okay, great. So now that I've got my medication, I'm going to go into my patient's room. Hi, how are you? Could you just tell me your name one more time, sir?
Ryder.
Okay, and your name?
I'm 67.
67, okay. And do you have any allergies, sir?
No.
Okay, great. I'm going to go ahead and give you your insulin shot in your right arm, okay?
Okay.
I'm just going to clean you off with an alcohol swab. It's going to be real quick. I'm going to go ahead and pinch you. I'm going to insert this at a 90-degree angle. Okay? Now this is always going to go in the sharps container, anything like this. So I'm putting that in the sharps container now. And after I inject the medication, I'm going to wash my hands again, and I'm going to check just to see if there's any signs of inflammation or irritation around the injection site. Okay, so stop working here for a second. Guess I'll re-scan it, but I guess it exited out. Okay. So after I administered that, I'm just going to write down the time that it was administered. It was a subcutaneous injection in the right arm. Patients, I gave 16 units, and the patient's blood glucose was at a 290 when I administered the medication. I'm going to always initial here. And I can write down any other notes, anything else that took place. So I'm going to go ahead and save that. Go back into the patient's room. Hi, how are you, Mr. I'm still in the patient's room. How are you, Mr. Kind? All right, so we gave you your insulin. You feeling okay? Any discomfort?
No, I'm good.
Okay, great. And I just wanted to go over again the signs of hypoglycemia with you. If you're feeling like any tingling in your mouth, extremities, any like chest, pain, like you feel like you have palpitations or heart's beating really fast, any confusion or dizziness or sweating, those could all be signs of hypoglycemia. Could you go ahead and just repeat a few of those for me?
Tingling in my extremities, and my lips, and then fast heart rate, and sweating, things like that.
Great, thanks so much. And also, you are on a 2-gram sodium diet, so I went ahead and got some pamphlets for you here that I'm just going to place on your bedside. You can just you can look over them, maybe give you a better understanding of the type of diet and what types of foods are going to be recommended for it, okay?
Okay.
And also, just whenever you're administering this medication, it's always important just to rotate the injection site. It's probably weekly, so you can rotate different parts of the abdomen. You can also do, either arm as well, if you want to rotate between that, just to prevent a skin breakdown with just repeated exposure of the needle, okay?
Okay.
Okay, great. So I'm going to go ahead and lower your bed down. And like I said, I'll put your call light right next to you. So if you need anything or have any other questions, feel free to call us. Great. Go ahead and place your call light here. Just go ahead and give that a tug, okay? So I can exit the patient's room, wash my hands again. Medication's been charted, and I can finish any other type of documentation, at a later time.
I have a few more questions.
Of course.
Were there any piece of information you reviewed before administering the client the medication?
Just the doctor's orders, the 5 patients' rights.
Did this information affect your decision to administer the medication?
Yeah, I mean, based on like what the orders were, what the patient's glucose was, and just to make sure that everything was being followed properly.
Did this information affect how you administered the medication?
No, it didn't. No.
Thank you.
All right, great. Thanks so much.